Hello everyone, this is the channel Daily Medicine. I welcome you all for the first lecture on my channel. Actually, on this channel, I'll be dealing with all the medical subjects, some of the medical subjects, the most important topics usually. First of all, I have decided to start with some of the topics of pathology. And as we know that pathology, it is systemic as well as general pathology. I'll try to go stepwise. First, doing some topics from general pathology, and then I'll go for systemic pathology. So without any further ado, let's just start with the first topic. Actually, the first topic I'll start is the cellular responses to stress and toxic insults. I'll be dividing this topic into various subtopics. These videos will actually be helpful for those students who study Robbins and Cotran's pathology, as you know. If you people study pathology from that, as you know, that is a little hard to handle for the first time and all. So I have decided to make these lectures so that I can facilitate students who read that book. So I'll start with the first unit, and what I'll do today is I'll just start with an overall overview of the unit and overview of this unit and how it is related to the whole broad perspective of pathology. So let's just if we talk about pathology, as I have told you already, pathology, it is divided into two: general and systemic. What we are going to do is, in general pathology, we'll be studying some of the basic concepts, some of the most general concepts which apply to most of the organs. And then systemic pathology, what we'll be doing is that we'll be studying systematically every organ, or we can say most of the organs which are important in our body. Alright, so if I start with an introduction, I'll say that anything, see, we have studied physiology first of all, and now we have to study pathology. What is the correlation? In physiology, we used to study the normal pattern of a human body, or the normal way a human body functions. Now in pathology, we'll be studying about the abnormalities that occur in the human body. So if we talk about generally what will happen, any disease, all right, any disease that occurs, how does it occur? Any disease, whatever the mechanism, whatever happens, first of all, it leads to cell injury. If we talk about a molecular or a cellular level, it first of all leads to cell injury. Any disease whatsoever, followed by cell injury, it leads to tissue and organ injury. And this tissue and organ injury, it leads to functional disturbances in the body, as a result of which there are certain manifestations or clinical features of a disease. So we can, by these clinical features that I already talked about, and by certain morphological manifestations that the disease has, we can diagnose a disease. And once a disease is diagnosed, we can then give specific treatments for the disease, as have been found by the various pharmacologists, and other treatments like surgeries and other things. So this was in general what happens in a disease. So whenever we talk about a disease, any disease, we talk about four things in general. This you need to remember so that it becomes easy for you when you study any disease in general. First of all, we'll talk about an introduction of the disease. In the introduction, what are the basic things that we'll cover? We'll cover just the definition or what it is all about. We'll talk about the incidence. We'll talk about certain other things. In the incidence, we'll talk about the population mostly affected, whether males, whether females, the areas affected and all. Alright, then the second thing we'll talk about is pathogenesis most of the times. And yes, in the first introduction, we'll also briefly talk about the etiology. In the pathogenesis, what we'll say is we'll talk about the basic mechanism, the mechanism of causation of the disease, alright, and the various genes or the environmental factors that are involved. Then the third thing we'll talk about is morphology. In morphology, we'll give a brief overlook about the morphological appearance of a disease, and then finally we'll talk about the clinical features of a disease, and this will be followed by treatment and diagnosis, or I can say diagnosis first and then treatment. Alright, signs and symptoms, then diagnosis, and then we'll go for treatment. This is the general overview. So I hope the basis is clear to you. Now we are going to start the topic that we actually had to start today, that is cellular responses to stress and toxic insults. I'll just give a brief overview of what are the various cellular responses that occur, and then one by one we'll discuss them in next classes or the other sections. All right, So I'll describe this introduction in the form of a flow chart so that it becomes very easy for you to remember. All right. So first of all, if we talk about any cellular response that occurs to any insult, what happens? We'll first of all say a cell we have which is normal and it is said to be in homeostasis. Homeostasis. All right. What happens to a cell which is in normal homeostasis? What happens to a cell? There might be certain things that might happen to it. First of all, say there are certain altered physiological stimuli. All right, or certain non-lethal injurious stimuli. Non-lethal injurious stimuli that occur or that approach or that affect a cell. What happens because of that? The cells adapt. There is a process known as adaptation that occurs. All right, adaptation. And what is this adaptation? If we talk, we'll actually be talking about all these things in detail in the next lecture, so I'll not talk about it much. So but I'll just say there are 4 types of adaptations. There will be either hypertrophy or hyperplasia, metaplasia, or atrophy. All right. And what happens? This adaptation, it is most of the times a reversible process. So if this stimulus it ends or the stimulus is removed, what happens? The cell goes back to normal. That is when the stress is removed. All right. But if the stress isn't removed, what will happen? Or there is inability to adapt. What happens is there is cell injury. Cell injury occurs. And this cell injury, it may be of many types. Either it can occur because of an inability to adapt, or it can directly occur from a normal cell if there is certain things like reduced O2 supply or chemical injury, or if there is a microbial infection. All right, or if there are certain mutations. In general, these are certain things that might directly lead to cell injury. And once the cell injury occurs, it is now usually of 2 broad types. All right, the cell injury, it might be either mild and transient, or the cell injury may be severe and progressive. All right, if it is mild and transient, it is generally known as reversible injury. But if it is severe and progressive, it is known as an irreversible injury, as we all know. This is just basic concepts so that you will be able to easily grasp what the whole context, the broader context of what is the general pathology. All right. And this reversible injury, usually once the stimulus is removed, or once after the bad stimuli or the toxic insults they are removed, the cell usually reverts back to normal, or it goes back to homeostasis. However, in case of irreversible injury, what happens? Usually there is cell death. And how does this cell death occur? This cell death occurs by 3 major processes. Actually, there are 2 major processes and a minor process that we'll be discussing. The first process is apoptosis, which is, in other words, also known as programmed cell death. All right. This is a very important thing that you have to understand. If you understand apoptosis, you'll understand most of the topics in general pathology which are related to this, including some of the topics in neoplasia, in autoimmunity, etc. So this is a very important topic to grasp. Then the second one is necrosis. And final one, which is actually a subtype of necrosis, that is necroptosis. It is actually a combination of necrosis and apoptosis that I'll be explaining what is it and how it is a combination of the two. All right. So this is a general overview. Let me get it into the frame, all of it. So even if you want, you can get a screenshot of it or anything like that so that you remember it easily. All right. So this is the overview that we are going to talk about, all right? Followed by this, there are certain other small changes that may also occur, or other responses that may occur, which include intracellular accumulations. Intracellular accumulations of various substances may occur, like calcifications may occur, all right? There may be other thing about, after that there may be pathological calcifications, all right? Pathological calcifications, and there might also be cellular aging. These two usually occur in response to metabolic alterations and chronic injury. While as this one, it occurs usually because of cumulative sublethal injury, which occurs over a long lifespan. Alright, this is the general introduction. Now in the next topic, or in the next lecture, what we'll be talking about is, we'll be talking about all of these one by one. We'll be talking about adaptation, we'll be talking about the cell injury and the types of it. Thank you.